Welcome to Big COVID Bang, the late night show broadcasted on EK18 where we discuss about COVID-19. On today's show, we are glad to have the leaders of US, Russia, South Korea, and Vietnam to have a discussion on the pandemic in each country. And also today, we hope to find our common ground on similar issues in the future. First of all, President of the US. According to statistics, there are 17 million cases and 308,000 deaths in your country. You have the most cases as well as the most deaths. What is your view on this? And do you think you have done anything wrong?
To be honest, I can say that everything we have done until now is wrong, but most part have gone beyond our control. It's been undeniably the darkest December on record here. As of this last week, COVID-19 is the leading cause of death in the US, even more than cancer and heart disease. We are not proud of it. We have made a huge mistake. COVID-19 is an assault on our body, on America's body, and a referendum on the ideas that animate our culture. Recovery is possible, but it demands radical introspection. America would be wise to help reverse the ruination of the natural world, a process that continues to shunt animal diseases into human bodies. We should have strived to prevent sickness instead of profiting from it. We could have built a healthcare system that prizes resilience over brittle efficiency and an information system that favors light over heat. We should have rebuilt our international alliances, our social safety net, and our trust in empiricism. We could have addressed the health inequities that flow from our history. Not least, we should have elected leaders with sound judgment, character, and respect for science, logic, and reason. However, there's light at the end of the tunnel for this horrible pandemic. Medicine is working at an accelerated pace and the progress has been promising, but we are not there yet. Our public health officials have told us that until the vaccine can reach everyone, if we wear masks, practice social distancing, and wash our hands frequently, we can take control of the coronavirus. Most Americans will not be able to receive the vaccine until well into 2021, but the rollout beginning this week is seen as a key symbolic turning point in the nation's battle against the pandemic, with hopes that take-up will be high. The pandemic has been both tragedy and teacher. Our very etymology offers a clue about what is at stake in the greatest challenges of the future and what is needed to address them. I feel like healing is coming. I hope there will be a miracles in December.
That's quite promising. Thank you, the President of the US. Moving on, as we all know, South Korea was quite late in applying social distancing. And when the government announced it, I know there are some demonstration against it. People seem to didn't realize the gravity of the situation. Do you think you have done well enough as a country's leader, President of South Korea?
Yes, we indeed let our guard up at some points. There was confusion among the citizens. People were unaware of the situation. Some still went outside for their unnecessary personal need. Additionally, and unfortunately, our failure to comfort the people has resulted in 3 waves of outbreak, giving rise to a number of protests which further aggravated the pandemic. On the other hand, with the help of intensive testing, our attempts at limiting the spread of the outbreak were successful. In its effort to fight and contain the virus, South Korea has combined testing with contact tracing. Infected South Koreans are required to go into isolation in government shelters. Their phones and credit card data are used to trace their prior movements and find their contacts. People who are determined to have been near the infected individual receive phone alerts with information about their prior movements. Those who violate a rule are fined up to $2,500. Besides, we have a strict requirement entry for travel, and in the worst case, a complete entry ban will take place.
Thank you, the President of South Korea. It's great that your country soon limited the spread of coronavirus after the first massive outbreak. The President of Vietnam, your country is really close to where COVID started spreading. Maybe that's one of the reasons why you guys took measures quite soon, even before the epidemic entered your country, and you guys did quite a good job. Which aspect do you think your government was most successful at? And what do you think other countries can learn from yours?
Thank you for your saying. It's obviously not easy to control the spread of COVID-19. Fortunately, thanks to the government's great leadership and the unity of all residents, our country is successfully able to fight against the pandemic. We recorded our first 2 cases on January the 28th on the flights from China. Then we immediately suspended all flights from mainland China on February the 1st, followed by all international flights on March the 25th. Visas and visitors were also stopped to contain the spread of the pandemic. All this seems to have paid off, as our country learned and grew from our experience in dealing with the SARS virus in 2003. We have put a strict social distance into effect and limit or even postponed the social events and meetings maximally. We also quickly established the National Steering Committee of COVID-19 Prevention and Control under the auspices of Deputy Prime Minister Vũ Đức Đam, which immediately implemented a national response plan. We have closed schools in January. Ideas of bringing students back to school have been considered, but then the school break remained in all parts of the country. Of course, now when we have mostly avoided the pandemic, the decision of letting all the students come back to school has been enforced. Mass quarantine for people coming from traveling across epidemic hit areas has been applied since early February, and the same request has been given to all entrants entering the country from March 21st. Since then, hundreds of thousands of people entering the country from badly hit nations have been put into compulsory quarantine in military barracks, benefiting army living standards with free meals and transport. By March the 22nd, our country closed borders to all foreigners, and international flights ceased altogether by March 25th. With other countries, including Singapore and Malaysia, reporting cases in the thousands and continuing various forms of lockdowns, our country, Vietnam, has done well to weather the storm compared to our peers and other developed nations. I think that our country doesn't have anything special or extraordinary to let the other countries learn, but I want to emphasize that the most important thing is the unity of our community, the great coordination between the government and the resident, which have made our COVID-19 fight to success.
Yes, unity is definitely the most important thing that helped your country to get through the crisis. Thank you, the President of Vietnam. Your country's success is really a lesson for the world. Today, we also have the President of the first country to announce their vaccine, Russia. The President of Russia, do you have confidence in your vaccine, and why do you think we need it?
As we all have known, COVID-19 is a dangerous pandemic, and up to now, nearly 3 million Russians have been affected by COVID-19, and over 15,000 Russians have died because of this virus. Understanding that social distancing and wearing a mask is not enough to prevent people from COVID-19, So the new idea came up is using a vaccine that can fight the coronavirus. Although it cannot cure people from the virus, a vaccine would teach us and teach our body to fight the infection by stopping us from catching the coronavirus, or at least making COVID less deadly. Russia, Russia has just released a new vaccine for COVID-19 named Sputnik 5. Early results from trials of this vaccine suggest it could be 92% effective. The 92% result was based on the data from 16,000 volunteers participating in the first trial. They received a dose of two vaccines then returned to the community where the epidemic spread. Up to now, more than 14,000 people in Russia have used this vaccine, and so far there are no safety issues, with Russian researchers saying there was no unexpected adverse events 21 days after volunteers received their two injections. This now has proved the effectiveness of our vaccine, and people should use our vaccine. Our vaccine will be sold to the whole world. The price will be under $10 so that every person will have a chance to own and use this vaccine. Moreover, we are improving our vaccines every day. Therefore, believe in Russia.
Many have pinned their hopes in your country's work. Thank you, the President of Russia, and good luck with the vaccine. As the President of the United States just said, this pandemic is both tragedy and teacher. This is probably not the last health crisis. From what we have experienced, what can we do to fight future pandemics?
To address the situation going forward, the policymakers must first of all recognize the centrality of public health and its critical role in nation building. The lack of understanding of the role of public health leads to it being ignored and not given its due importance. In the name of health, politicians often announce opening of new hospital buildings at considerable cost, creation of tertiary hospitals, or expenditure on sophisticated medical devices is, of course, important for providing diagnosis and treatment facilities, but this should not happen at the expense of investing on public health infrastructure and primary health care, or addressing social determinants of health. In fact, much greater investment is urgently needed to augment efforts to promote a healthy lifestyle, to prevent diseases, strengthen disease surveillance programs, and enhance research capabilities in the country.
I agree that there is a great need to advocate for greater policy support and financial investment for public health. Health is indeed essential to boost growth. A nation cannot hope to develop and prosper unless its population is healthy. India, with a disproportionately high global burden of disease, cannot develop economically to its fullest potential until its population is healthy and productive. Therefore, the government must invest more on public health. Of the meager current allocation on health, only 15% is spent on primary health care. It means that most of the health budget is going to build large hospitals or clinical care at the expense of health promotion and disease prevention. Isn't prevention better than cure? The entire country as a nation must have priority strengthen public health institutions, along with the human resource in the overall context of existing health system. The health system in the country is fragile and overstretched to the limit. The government health facilities are of poor quality fabric with lack of staff and facility forcing poor to cater to private providers incurring high out-of-pocket expenditure. Lack of staff contributes not only in undermining quality but also equitable access to basic health care by the poor and most vulnerable populations. In fact, the primary responsibility of any government is to help the poorest of the poor and most marginalized in the society. The government at the state level must formulate appropriate policies, including provision of incentive and creation of the enabling environment that can help ensure that doctors, especially specialists, go and serve in the rural or remote tribal areas.
That's exactly how I feel. The fragile health system has to result in the ever-present threat of Ebola, SARS, influenza pandemics, and dengue outbreak year after year, which necessitates that the strengthening of the epidemiological and laboratory core capacities in the country. The June 2019 acute encephalitis syndrome episode in Bihar demonstrates the health and political ramifications that can follow outbreaks associated with the emerging and re-emerging infectious disease. The competency-based epidemiology training and other field epide- epidemiology training programs are an excellent example which must be expanded so that ability to detect unusual events such as outbreaks early and respond rapidly is enhanced in all districts or priority basis, given the size and technical expert, expertise available in the country. The government must strive to establish a world-class laboratory for each emerging infection, linked with other public health laboratories as a part of laboratory network.
In conclusion, health challenges facing the country are enormous. A robust public health system is therefore needed to protect population from risks and dangers to health, ensure equity and social justice so that everyone everywhere can have equitable access to good quality health services, and to address the underlying cost of ill health in ways that provide population wide protection and prevention. It is also clear that without a strong public health system, the SDGs can neither achieve nor the nation policy initiatives can implemented effectively. Investing in public health is therefore not only a programmatic necessity but also an ethical imperative.
Thank you, the President of South Korea. That's the end of the show. Thank you for spending time with us today. This is Big COVID Bang, and have a good night.